Ancy on for our coffee talks and sharing such great information. It's awesome to be able to record it and, you know, share it with those who couldn't join this morning. So yay, let's go with that. Let's see, we've got some Carol and Eileen's back with us and Harriet's on with us today. Jan, good morning, ladies, and welcome back. Ancy Zachariah is here to talk with us about part 3 of the series on fall prevention. And Ancy, specifically, what is today's topic? Getting your screen share going?
Yeah, I was just trying to see if I can full screen. Yeah.
Okay. Perfect. There it is.
Okay, let me see, where am I here?
I'm going to go ahead and mute myself, Ancy, and let you get going because I know my computer sometimes makes some loud noise and I don't like it. So I'm going to mute myself and you can take the floor, okay?
All right, so good morning, everybody. It's nice to be back on Coffee Talk. And so we're going to continue with our fall prevention series here. As we touched on different causes, the main focus today is going to be different causes of falls. The big chunk of it is definitely medication that we covered extensively in our last month session. So today I'm going to cover about other factors other than medications. So today's objective is going to be environmental risk factors, reducing the environmental fall risk factors at home, intrinsic factors of fall, extrinsic. That means things that are medically that can cause you to fall and the other factors around you that can cause you to fall. And obviously last would be giving you recommendation on how to work on prevention, because that's the key when it comes to fall precautions. All right, today it's going to be more of talking. I don't have many slides. It's just going to be very talking, kind of explaining things from what I've seen, being a therapist for over 20, 25 years. Accidental, the causes and risk factors of falls that I've seen and that is evidence-based is accident and environmental causes. So there's so many things that happen in our environment that can cause us to fall. Like it could be a broken step, just having too many rugs in the apartment or your home, not having proper banisters, railing, especially in 2-level homes where you have just too many steps and you just don't have proper support. And then even the bathtubs, if it's just too slippery after you're in the shower, you have soap everywhere and the surface is not safe at all. Second point would be balance, walking, weakness. Balance, walking, weakness, it's such a wide area range. But it's a fact that as we get older, our balance, our strength is not the same. So we need to continuously work on those things. So I usually tell patients that if you find yourself that you tend to hold on to things when you're walking in your house, or you realize that you just don't feel safe without holding, that is a point where you have to start thinking that, is my balance not the same? Am I having challenges with weakness. So that's the point where you start thinking about it and not think that, oh, it's just normal aging. I just feel the way I feel because I'm older now. No, just because you're older doesn't mean that you should have balance or walking issues or weakness on your legs. So that would be a turning point to start thinking about it and trying to get your doctor involved. Dizziness and vertigo. This is huge. I have seen a lot of people having this particular, who fall into this particular category, and there are so many causes of it. And the key is to get diagnosed and get on the right track with being treated for it. So talking about dizziness, we talked about different things last time, which are the next point: syncope, postural hypotension, or it could be a side effect from a medication you're on. So just the moment you start getting dizzy, or you're just extensively getting more dizzier as the time goes by, or you have been put on a new medication and you feel that your dizziness is getting worse, that's the time to pay attention to it and make sure that it doesn't cause you to fall. Vertigo. Vertigo is a common diagnosis that is many a times ignored and not taken seriously, which can really, really cause you to fall. And the good news about vertigo is there is so much of therapy out there for vertigo. There is, we call it vestibular therapy. So it just breaks my heart to see people not know about it. There is therapy for vertigo. I'm not saying that every type of vertigo can be treated with therapy. No, there are some specific types that might need more extensive treatment and specialized interventions with an ENT. But the fact that if you have vertigo, it doesn't mean that you have to suffer with it for the rest of your life. No, you can do things to be in control. I always explain it to patients this way: you don't want the vertigo to control your life. You want to be in control of the vertigo. So does that mean once you start therapy, your vertigo is going to go away? No. The point is to know, once I get a vertigo attack, what can I do to make sure that I can manage my symptoms and be in control and still function. So that's the whole point of doing therapy. With therapy, it doesn't mean that once you do therapy, your vertigo is completely gone. You might have an episode again in the future. You never know, because it just comes on. So the key is to know that there are options out there that can help you manage your symptoms and be in control of the vertigo, and not let the vertigo control your life and, put you down and not be able to do the things you enjoy. Syncope, we discussed a little bit about that the last time we had the coffee talk. Syncope is episodes where you actually lose consciousness for a few seconds and you're in and out of it pretty quick. And it happens so quick that you don't even know. It'll just happen and you're back. And if somebody's not really observing you, you might not even know that you did that. The reasons of syncope is like your heart rate really drops. We call it bradycardia, where your heart rate really drops below 40s and into 40s and 50s. So and it then comes back up. So if you have symptoms like that, it's time to consult the cardiologist. And you might be a candidate for a pacemaker, you never know. So the cardiologist needs to check that out and see if there is some rhythmic issues with your heart. So that is one of the biggest causes for falls in older adults, syncope. And the unfortunate part is they don't even know, they don't realize that their heart, because you really don't feel that your heart rate is dropping. It doesn't, physically, you really don't feel it. You might sweat a little bit or something, and then you're back in action. And it's such a quick phase that it doesn't give you enough time to think about it. So that's why it gets pretty unnoticed at times, and people don't realize it happens frequently. Like it might happen a few times in a few months and you don't think about it much. And then the next time it happens, it causes you to have a huge fall and you end up having a bad injury. So syncope is very, very important to know about and pay attention to. And if you live in a house with your spouse, make sure you talk to each other about syncope, because it's nice if people can observe you, and if you kind of pass out for a few seconds and come out of it, it's nice that other people know about this. Talking about postural hypotension, we talked about this as well. It is your blood pressure fluctuating, your blood pressure going low as you change position. So from lying to sitting, sitting to standing, your blood pressure varies. So in the middle of the night, when you're trying to go to the toilet, if you get up and you're rushing to the toilet, you're not giving your body enough time to get that blood pressure stabilized. So the ground rule I usually tell patients is wait for at least 10 seconds, if not more, in that particular position. So you lie down, you sit up, wait for 10 seconds. Sit to stand, wait for 10 seconds before you head to the toilet, because you're giving your body that time to stabilize the blood pressure. So, and especially if you're on high blood pressure medication, it does its job. It tries to bring your blood pressure down. And then if you try to move too fast, it can really cause you to fall. So you have to watch it if you're on high blood pressure medication to make sure you don't have postural hypotension. Dementia, that is again a huge, wide area, but just knowing the fact that if you have dementia, you can increase your risk for fall. I've seen patients who, the commonest example I can see is they are more comfortable walking with an assistive device, but they forget their assistive device. They forget to use their walker, the cane, you know, and then they just don't remember to use the assistive device going outside on uneven grounds. That becomes very hard, and it becomes very hard on the family. So if you come to a point where you're having cognitive memory issues, it's time to talk to your doctor, get a speech therapist involved, let her do a baseline cognitive assessment and see what options you have in terms of helping your memory. So some simple things that I usually recommend patients is, if you use a cane, and if you feel more comfortable walking with the cane, even in the apartment, keep 2 of them. Keep one at the door, okay, and one in the apartment. That way, when you exit the door, you're going to look at that cane and you remember that you have to use the cane. Or put a note right at the door that please take your cane. Things like that. They're simple ways to help your memory when you end up having memory issues. Simple things that can make your life so much easier. And I always tell patients, especially with the ones I have with when I'm treating them for vertigo, I tell them to put signs on the wall reminding them to do their exercises, because that's the only way they can feel better. So simple things like that can help you with your memory as you age. Visual disorders, that's again a huge range. There's so much happens as we age with our vision. I remember one of my patients telling me, Ancy, just enjoy your eyes when you're young. Just get all the reading done, because they're not going to be the same. And I really value her wisdom that she shared. It's so true. We just take our vision, hearing, everything for granted, but once we would definitely appreciate it more as we age and start losing those. So visual disorders are huge. There are some visual disorders like macular degeneration, where the depth perception gets worse as you age. So definitely making sure you're getting a visual test every year, seeing the eye doctor. If you need a increase in your upgrade in your lenses, make sure you're going ahead and doing that. And of course, the topic that I covered last month, polypharmacy, The more you're taking, the more your chances of falling. And it obviously depends on what you're taking. And so as I covered in the last session, if you have been hospitalized, you were put on extra medication, make sure you go and talk to your primary physician and see what can be cut down. You probably don't need that much of, the most common thing I've seen from my practice is that you went to the hospital, you are very sick, they put you on a lot of blood pressure medications, your blood pressure was skyrocket, you really needed those meds. They send you on a little lesser dose, but still on quite a bit of medication. You come back home, you keep taking those medications, and your blood pressure drops and you have a fall. So it's very important that once you have come back home, you want to make sure you get in touch with your primary physician and let them go through your medications and see if there's anything that we cut down, even just cutting down the dosage. Do you need to ask if you really need to be on all those strong high doses or not? So having an open conversation with your physician is very, very important to make sure that everybody's on the right track when it comes to the medicines. I would like to cover some chronic health conditions that can increase your chances of falling. And the first thing that comes to my mind is diabetes. It is a chronic disease that just has so many long-term implications on your health. So one thing about diabetes is the sugar control, and how when you get to a point where your blood sugar drops and you go into a hypoglycemic state and you are going to have a fall. So hypoglycemia, everybody's body is different, but the most commonest symptoms that you can people usually relate to is irritability, just not being able to comprehend, getting very sweaty and just very irritable. So I usually tell patients, if you have been a long-term diabetic, you probably know how when you start going hypo, so, and the problem is if you don't take the right action at the right time, hypoglycemia can be very, very dangerous and life-threatening. So once your sugar drops, you can go to a point where you get so disoriented, you don't have a judgment right there. I've had patients where they have absolutely no judgment. They won't be able to tell you, my blood sugar is dropping, and please give me something, an orange juice or something to eat, or it just happens so fast. So it's just, if you have a spouse or a family member who is diabetic, you want to make sure they're aware about this and you're aware about this, that you don't want to go into that stage where you go hypo and then it starts dropping so fast that you're not able to communicate with the people around you and let them know. So just watching for that your sugar levels are not dropping and you're not falling because of that. Relating to that, I would like to cover diabetic polyneuropathy. The unfortunate part of diabetes is that it being the chronic disease that it is, it just has so many repercussions in the long run. It just affects your nerves, it affects your eyes, it affects your kidneys. So diabetic polyneuropathy is basically your nerve endings on especially your feet, are less receptive as your diabetes advances. So what happens is that your sensations are altered. You really cannot feel the same way on your feet when you walk. So it's very important, and that can cause you to fall. So it just becomes very hard when, so basically the point is to make sure you're taking, if you're a diabetic, you have to take care of your foot. You have to examine it every day. You have to wear a footwear. You have to keep your numbers and your A1C level under control, because otherwise you're going to pay a big price. You cannot afford to lose your toes. You cannot afford to have open wounds and infections on your feet. That's the total wrong route to go. So just be very careful. If you're a diabetic, you have to pay attention to keeping your numbers under control. Get in touch with your endocrinologist. Do everything that is possible from your side to make sure you can keep those A1C number levels under control, and making sure that you don't go hypo at the same time. Peripheral neuropathy is again a condition where it's the same thing like diabetic, but it's slightly different in the sense that diabetes is not the cause for the neuropathy. Some patients just have it in their families. So the symptoms you get is burning, tingling sensation, just very restlessness. So when you walk, usually the patients, the way they describe it to me is that I feel as if I'm walking on a cloud. I have no idea where I'm stepping. So that can be pretty dangerous when you have no idea where you're stepping, and your nerve endings on your feet is not sending the information to your brain that, this is an uneven surface. You have to be extra careful. So if you suffer from this as you get older, I tell patients it's okay to look down, especially in an uneven surface. Say you go out to eat in a restaurant and you're with family and you're walking through the curbside and it's pretty uneven. It's okay to look down and make sure that you're stepping on the right spot, and your feet, because your feet is not giving you that information. You're not getting that a normal person gets when they take a step. So it becomes very hard to kind of get around when you have a peripheral neuropathy. And the unfortunate with medications, it will just help you with the symptoms, but to get around and do your daily function, it can be pretty challenging. But again, exercise is wonderful way to kind of keep your strength up. When you have peripheral neuropathy, you don't want to be having a compromised strength issue there, because you already are going to have a balance issue, because you don't have the same sensation as a normal person. So you have to make sure you don't get compromised with your strength at the same time. So because then there are two factors fighting against you. So you want to make sure that you keep up your strength and not let that neuropathy take over and cause you to fall. Arthritis, again, something that happens as we age. I always tell, we abuse our bodies when we are young and we pay the price as we get older. We just love the things that we do and we don't think about it in the long run. And that's life. You just do stuff, you enjoy life and you go on. And then as you get older, you feel that, okay, I did too much when I was young, and that's why my knee and my hip bothers me too much. So just making sure that if you have an arthritic joint, you do the best you can in terms of pain management and keeping it moving. That is the key, to make sure you're moving, keep moving in. And if you've just turned 60 or 65 and you have a real bad arthritic joint, I would say go consult an ortho and see what your options are, because you don't want to keep it on a back burner and 10 years, 20 years down the line, the ortho says, oh, you have to get this operated, but sorry, I cannot give you medical clearance because your heart is not doing great. So you don't want to get to that spot in your life. So when you're younger, get your joints checked. If it's really bothering you, get it checked and see what your options are. If you want to, if it's really not too bad, go consult a physical therapist and get moving, learn the exercises, keep it mobile. just keep moving. Stroke. Obviously, once you have had a stroke, depending on how good or bad your stroke was, you can have balance and strength issues that can last for a long time and can be with you for the rest of your life. So just being careful and follow the recommendations of the therapist who have been working with you. If you need an assistive device, make sure you use one, and just continuing to do your therapy. And once you have learned your exercises, making sure you continue to work on them, because that's going to keep your strength up and that's going to keep you independent. Chronic obstructive pulmonary disease, COPD as we usually call it, those can be pretty debilitating, especially if you have had an acute onset, you have a real bad onset of shortness of breath, and you end up getting admitted to the hospital. And in the hospital, usually you're just laying around and not doing much, and you can really lose your strength if you're not moving enough. And plus you're on steroids for a long time, and that also takes the energy out of you. So it's very important that you continue to, so say you had an episode of COPD, you're in the hospital, the inpatient therapist comes and talks to you and says, Mr. So-and-so, would you like to go for a walk? Let me see you get up. Don't say no, just say, I will try it, because it's very, very important that you get moving. It's very important, because every time you're just going to lie down there, you're going to continuously lose your strength. So, and post-hospitalization, you come back home, you just don't feel the same way. You just don't feel like you're not able to function. Don't take it lightly. Make sure you address it, talk to your doctor, get a therapist home, or start an outpatient therapy. Do what you need to do to get going with your health, your strength. So don't just take it like, oh, it's just part of the disease process. I was in the hospital. You cannot take that chance, because you cannot afford to lose your strength and balance over a period of time just because you were hospitalized. So just kind of pay attention to that. Vitamin D supplementation, there's not a lot of strong evidence for it, but there's moderate evidence that it can cause you to fall. But the main thing is to know that actually vitamin D is a lot in news now, because of you can be more susceptible to COVID if you're vitamin D deficient. That is also pretty interesting with the latest studies with COVID. So the main thing is to know that you get your vitamin D checked, discuss with your doctor, make sure it's being checked at least once a year, and make sure that if you are low on it, you are getting supplements. And when the weather is nice, go and sit out, enjoy the sun for at least 20 minutes, and make sure it's directly on your skin and not on your clothes, because you don't absorb it otherwise. Obviously, again, consult with your doctor. If you have a history of skin cancer, consult with your doctor. You probably don't want to be in the sun if you do have a history of that. So as I said, there's not a lot of strong evidence for it, but it is something that you want to keep a check on and get it checked, and making sure you have the supplements needed, especially when you're through the cold winter months. We're not going to get much sun anyway. So it's nice to get it checked, and making sure that you're on top of that would be great to keep yourself safe. Some simple tips to fall-proof your home. I've seen a lot of patients trip on their pets. So, so just make sure your pets are restrained, or you have trained them enough to know that they shouldn't be coming in your way. Especially, I've had patients who have had a hard time, especially when they go back home after surgery and they have just small dogs and they're just in their way. So the simple way to do that is just getting some baby doors, in between rooms, so you know that you can just keep them in one place, especially if you're trying to recover after hospitalization or something like that. Remove throw rugs and items on the floor. I always tell patients, make sure that your high traffic area is always clear. Keep the high traffic, the area that you're going to be walking most of the time. Just keep it clutter free. Take all the things out. Make sure you have enough room for your assistive device, your walker. You have enough room to turn with the walker. So make sure, try to get as much clutter out of your way as possible. Make sure you have enough lighting, especially in the night. If you end up using the bathroom a lot, because that is also a, very much strong evidence on patients with urinary incontinence have a higher risk of falling. So making sure that you eliminate the bathroom and the hallways enough to make sure you can see where you're going. Slip proof your tub and shower. We talked about that earlier. And making sure that you're wearing a good fitted sturdy shoes to keep yourself safe. All right, so taking the right steps to prevent falls, it's going to be a gist of everything we talked about. Staying physically active, especially if you are staying at Westminster, make sure you go work out with Lauren. She does a fabulous job keeping you active and just moving. Keep challenging your balance. I know she does a balance class, so keep that. Make sure you participate in that. And if you are not living at Westminster, if you're outside, some of your insurances will cover exercises. I can't remember the name now. It's Managed Medicare will cover Humana. Some of those insurances will cover the exercise classes. So make sure when you get your insurance, you check with them if these classes are covered. Right now with the COVID situation, it's a little harder, I know. But just being aware that your insurance covers these exercises and you can go and go ahead and get yourself enrolled. So once you enroll yourself, you have a push to go and do it. I'll be covering more of that in the next session, next month session. And having your eyes and hearing test. So as we mentioned earlier, vertigo is because of the imbalance that happens in your middle ear. So making sure that you're getting it tested and making sure you get your hearing tested, and once you start having balance issues, make sure you talk to your doctor, get an ENT consult, let them make sure that there is nothing going on with your vestibular system that can cause you to fall. Find out the side effects of medications. So as I spoke the last month, your pharmacist are your best friend. Talk to them. Once you're put on a new medicine, ask them if it can cause you to fall. Does it increase your fall risk? Does it cause dizziness? Does it interfere with the medications you're already on? So ask those questions. The pharmacists, they will really help you out. And the good thing is they when you go collect your medication, they will ask you, do you have a question for the pharmacist? And that's the opportunity to grab. Because many times my patients will say, oh, my doctor was so busy, he hardly had any time, so I really didn't get a chance to talk to him. So if that's the case, you just need to make sure you are communicating well with your pharmacist. Get enough sleep. Obviously, we all know that if we haven't got enough sleep, we're going to be, it can affect how we feel, our mood, our balance. It can cause us to fall if we are really not getting enough sleep. So make sure you do that. And limit the amount of alcohol you drink. So again, that is also, it can affect your medications, the medications you're on. Discuss it with your doctor if you can have alcohol with those medications and how much. You don't want to, because medications are chemicals, so mixing chemicals with alcohol. So make sure you have a good understanding on how much you can drink or what your limitations are, or you cannot drink at all. So just having that understanding is huge, and making sure you do what you need to do to make sure it's not alcohol that's causing you to fall. Stand up slowly. We talked about that already. That is with respect to postural hypotension. So make sure you give yourself at least 10 seconds or more when you're changing positions to keep you safe. And if you are starting to feel unsteady, make sure you use an assisted device. And that's the time to consult a physical therapist, or talk to your doctor first and consult a physical therapist. And as I mentioned earlier, if you find yourself holding on to furniture more, you just don't feel secure walking between rooms without holding on to the wall or the furniture, it's time to start thinking, why am I doing that? It doesn't mean just because you're aging, you need to start holding on to things. No, there is something going on that needs to be addressed, and you need to start working on it. Be careful on uneven surfaces, especially if you have peripheral neuropathy. That is the biggest risk you will have on uneven surface, because you are not getting that proprioception, that feedback from your legs to tell you where you're stepping. So be very careful and use your visual feedback. You can look down when you're on uneven surface, or hold on to your family, or hold on to your assistive device. So making sure that you understand that if you have a diagnosis of peripheral neuropathy or diabetic polyneuropathy, it's very important that you use your visual feedback to keep yourself safe from falling. Proper footwear, that I think is just good common sense thing, that you want to make sure that you're wearing something that's comfortable, that's going to give you complete support on your feet. And this is very important. Always tell your doctor if you have had a fall or a near fall. Make sure you tell the doctor, because he needs to know, and that's how they can assess the reason for the fall. You know, even if you think that, oh, I just cannot explain it, why it happened, probably you cannot, but it's nice for your doctor to know that you had a fall. It's very important, because otherwise he might be thinking that, oh, she's doing good, or he's doing good, and there's nothing going on. So there is nothing wrong about letting them know, so that they can start assessing, they can start figuring out why it happened. Even if it was just a fluke accident, you just slipped on something, just mention it to your doctor. It's not going to cost you anything. It's just nice for the doctor to be aware that you did have an episode of a fall or a near fall. And if you caught yourself, very good. Keep up with that. So, I guess that's about it. Any questions?
I wrote a lot of stuff down. One of the things that I was curious about, you mentioned seeing a speech therapist if you have some cognitive challenges or dementia. Tell me more about that. What's the purpose there?
Well, once you start having memory issues, the speech therapist, they do a basic cognitive assessment that gives you a fair, just gives you a baseline where you stand with your cognition, to basically know that is there anything that they can do to help you in terms of improving your memory? There are different strategies that they use. And even just making sure you don't need a neurological consult. So just making sure that you're aware about this, that once you talk to your doctor, ask the doctor about just getting a baseline cognitive assessment done. It just gives you an idea of where you stand with your memory issues, in the spectrum of dementia, where you stand, and what can you do from there to help yourself. That's basically what you're trying to look at that point. Hello, can you hear me, Kate?
Oh, yes, I sure can. Yes.
Okay.
I was thinking, I know I had other, oh, I know. You mentioned vitamin D. In the winter, obviously, we're not going to be outside as much, or at least, spending a long period of time outside in the sun. But what if you're just sitting in your home, you have, or a window where the sun comes in? Can you still absorb it through your windows, or is it not working?
Yes, you can, but you have to make sure that it is directly on your skin and not on your clothes. So, and the recommendation is at least 20 minutes.
So if the other day, sitting, went out and down the hall and sat by a window and kind of propped her legs up, on her walker and pulled the pants of her legs up, so that she could get her pant legs up, yeah, so that she could get the sun kind of coming directly in on her skin. I thought, oh, that's really smart. Good for her. Good for her. We can all do that, right? Just pull up your pant legs a little bit and maybe.
Yeah, provided you don't have a history of skin cancer. So that's why I said consult your doctor.
Mm-hmm.
If you do have a history of that, you want to make sure you watch it and make sure you're not too exposed to the sun if you're super sensitive to the sun.
I think another important one you mentioned is shoes. I see a lot of ladies who tend to wear just little slip-ons and things, probably because they're easier to put on. You don't have to bend over and tie and things, but they certainly don't provide much support. So I could see that causing falls. Do you have a recommendation on the types of shoes people should wear?
Well, especially you're up and ready for the day, wear something that gives you good support through and throughout your feet, like something that supports your heel at the back as well. Don't opt for something that keeps your heel exposed, in short, But obviously, when the summer months comes, everybody wants to wear a sandal. I'm with you guys. I love my sandals too. So it basically, it all comes down to what you're comfortable with. But as you age, you want to make sure you're getting a good support on your feet. So sometimes as we age, if we are getting too unsteady and we are sensing that our fall risk is increasing, it's time to ditch fashion, I would say, and go with common sense and put something that gives you good support. That's all that's what I feel we should do,
I think another thing that I kind of just wrote down was, you mentioned, share, you have to tell your doctor, you have to, to share this information, and in order for them to be able to properly help you, they can only work with the information they have, right? And if you don't give them all of the information about what's going on with you, they can't properly help you. But I also kind of picked up on something you said about with certain, I think, diagnoses and such. I know we tend to want to kind of protect our privacy and not share a lot about our medical history, but it could, in certain situations, it could really benefit you to make sure that your friends, the people that you go out and about with, maybe even your neighbors, know about some of your conditions, so that they'll know how to respond if there is a crisis or a situation, especially if you're diabetic, I guess.
Yeah, especially I would say if you're a diabetic and you know that you can be a brittle diabetic where your sugars cause you a havoc. They just go high up crazy, that they just drop. It's a tough situation to be in when they call it a brittle diabetic, where you just struggle every day to just keep your numbers at a decent level. So I would say that if you are one of those people who are really struggling to keep that sugar number under control, talk to your friends and family. They need to know. When, say, you're going out for a concert or a picnic or something, and you know that there is a possibility that you can go hypo, it's nice for them to know, and keep like the glucose tablets that you get at the pharmacy that can be instantly put on your tongue, and your blood sugar can go back up. So things like that, and just your friends knowing that you always have that tab in your purse or, just making sure that they're aware that there is a possibility that you can go hypo and they know what to do and how to help you. So yes, that's a good idea. And just making sure that you communicate to your close friends about what your health condition is. It is really very relevant if you're a diabetic, and if you're a brittle diabetic and you struggle with just keeping those numbers under check.
That makes a lot of sense. Does anybody else have any? I've taken up all the question time, I guess, haven't I? Does anybody else have any questions that you want to kind of type in, or maybe raise your hand and with the button at the bottom of your screen so that you can ask Ancy any questions that you might have?
Yes, or yeah, feel free to raise your hand as well. I know I've been kind of keeping my eye out and looking at everybody's, but let us know.
You shared a lot of really great information with us, so I think that we need to sometimes stop and realize that, a diagnosis of whatever isn't just that, it can, to think about all of the things that it could also cause or lead to, or, and I think the biggest takeaway is just, notice these signs and symptoms. And when you notice a change, say something so you can do something about it.
Yeah.
I think a big takeaway is you said that, oh, we just assume that's because we're getting older. And, I hear that all the time when I'm meeting with people. They say, oh, I'm just getting older. I'm just getting older. But you're right. We don't have to, limit ourselves or expect our balance to go bad as we age.
Yeah. And if it is going bad, there must be a good reason behind it. We need to look into it.
Yeah.
Stay in control, keep moving, right? And
keep Lauren in business.
Especially now. And so if you are, you can't go to those classes and get out to your gyms or your silver sneakers and all that stuff, please know that we're sharing lots of exercise classes on our Facebook page that you can check out. Email you links to classes that are led by NIFS professionals and things. So don't just give up on it just because you're stuck at home. Let me know. I'll send you stuff for free that you can watch and follow and get your balance class in and everything. So,
Ancy, I do have one more question for you, just really quick. You
Sure.
had mentioned that sometimes Medicare or insurance can cover like different classes. Can it cover a gym membership or pay toward a gym membership?
No,
that maybe as a personal trainer?
I know for sure it covers silver sneakers.
Okay.
I know the advanced Medicare Advantage, I guess it's considered Humana, United Health Insurance. Those cover silver sneakers. So when you get, during the open enrollment period, it's a good time to ask your insurance provider if they cover it. I'm not sure if regular Medicare covers it or not. And then your local YMCA, they have silver sneakers. So you don't, even if your insurance doesn't cover it, you can just join your local YMCA. And I think here in our community, it's a Union Hospital. They provide silver sneakers too. So your local YMCA is a good resource. Check with Union Hospital. So you don't have to have that insurance to get into silver sneakers, because YMCA will get, I think they do have a senior discount too.
Good.
So just having those resources and just knowing that you have options is huge, But I know for sure the managed Medicare, most of them, they do cover silver sneakers.
Yeah. And residents at Westminster Village have the beautiful benefit of fitness classes every day here with Lauren, stretch class and balance class. Even on the weekends, our residents lead the classes. So yeah, that's a huge benefit to the residents, maintain balance here. Thank you again, Ancy. And next month, we'll have kind of the fourth and final of your series on fall prevention, correct?
Yes,
and what
it'll be focused on resources. So we're talking fall prevention, right? Now, what are the resources that we have? So I'll talk about the resources that are available in the community. and also all the evidence-based programs that have shown results in improving your strength and balance and decreasing your fall risk.
Thank you so very much for your time. And we'll see you again next month.
All right. Thank you so much. Have a good day, everybody.
Yeah.
Bye.
Have a good day, everybody.
Bye.